Good afternoon. We'd like to welcome you to the Healthy Flint Research Coordinating Center, now our weekly webinar on coronavirus. As you all know, my name is Yvonne Lewis. I'm your host today. I am so excited to have this opportunity to share with you and for you to share with us. I'm serving as the co-director for the Healthy Flint Research Coordinating Center as we bring this webinar to you. Our goal is to bring information to you about what we've known as a pandemic or a global issue with our relevant context to our community. This Healthy Flint Research Coordinating Center effort is led by community and three academic partners. The academic partners being the University of Michigan Flint, University of Michigan Ann Arbor, and Michigan State University. We're looking forward to an exciting webinar today. I want you to remember that we have a number of extremely awesome partners, and we've talked to you about this for the last 24 weeks. Our partners range from hospital systems, our community health federally qualified health centers, Genesee Health Plan, and they're all listed, they're all shown here on our partner slide. And for those of you that are joining us by phone, just know that there are just a tremendous number of organizations that have partnered together to be sure that we're bringing relevant information to you. This includes the state of Michigan, our city, as well as our county health department, the Michigan Department of Health and Human Services. MTA is even a partner with us. So we want you to know that you can put your questions into the queue for any of these organizations that have been partnering with us over the last 24 weeks to ensure that the questions you have are answered in a timely manner. I want you to also know today, for those of you that are joining us, that we will have representatives from the legal team who spoke to us last week about the Flint water crisis lawsuit settlement. And I label it as the Flint water crisis lawsuit settlement because there's a whole lot of lawsuits going on, but this one particularly is going to provide for us information as related to that particular settlement. So please stay tuned for that information that will be coming forward. We'll also today provide for you updated information from our Genesee health system about mental health. So many of you ask what's going on, what are the supports available? And so we're going to elaborate again on that today. And of course, we have the health department that will share with us and the city of Flint. So in keeping with our conversation with our partners, the city of Flint, which is represented by Dr. Lawrence Reynolds, who is the health advisor. And I like to say this, chief health advisor. That just sounds so good, Dr. Reynolds, chief health advisor for the city of Flint, because we just need to have somebody who speaks on the community's behalf from that perspective. And so we appreciate you doing that. So Dr. Reynolds, we have a lot of updates, and I know I've only got a limited amount of your time today. So would you please share with us updates from the city of Flint?
Yes, I will just say this briefly. We are still in the early middle phase of resolving this pandemic. So please conduct yourself accordingly. And I'll leave it at that part because we have an old issue that we've been dealing with for the last 6 years, and that is replacing lead service lines. It was once known by another name. Now the name is Get the Lead Out, and you can find it in your water department, City of Flint Water Department, or you can listen to what I have to say now. Call as soon as possible if you do not know if your service line was replaced. Call as soon as possible if you said no before and you changed your mind and you're ready to say yes. We must get this work done by September 18th. Understand that the funds that we use to pay for this service will be withdrawn if we don't get this done. It is not the City of Flint choice. So we have a deadline, and we need you to let all your friends and enemies know September 18th is the deadline. And how do you do that? You can call this number, 810-410-1133. 810-410-1133. And the same area code is 232-2558. You can call there also. You may get someone by the name of Jennifer Allen at Row. Leave your name, your phone number, and address, and you will be called back if you leave that information on the voicemail there. Now remember, the property owner must give permission for this to be done. So please, when someone calls you back, make sure there is someone there that can say, yes, please proceed. And please do not guess if you have a lead service line or a copper service line or a galvanized steel service line. Don't guess. Get it checked, and we can proceed from there. And it's a two-step process. After we get the most important part of this work done, which is replacing the lead service line, and you flush your lines, and you'll be given instructions for that. The next important part is if you're concerned about the appearance of your lawn or the safety of your walk, you have to call another number in order to get that repaired. So it's a two-step process. But the bottom line is September 18th, 2020 is the deadline, and the number is 410-1133 or 232-2558. Thank you.
Dr. Reynolds, just a couple of quick questions, if you would. Now, you mentioned that there has to be someone there. This has to be an adult person, someone over 18.
Yes.
That gives permission for that. And if no one is home, what happens if I'm not at home when someone comes to my door?
That I cannot answer. That's why it is so important when you get the call for your work and your work is scheduled that there be somebody there. We have a lot of things that come up like changes in the weather, rain, storms where the work cannot be done. So you should stay in contact with those numbers that I gave you, 232-2558. You did bring up bring another thing to mind, and that is if someone says, well, back in 2019, I called and scheduled, and they said, okay, if you have not had that lead service line replaced, call again. Do not hesitate. We do not know what happened to some of that information under the previous administration. So we are trying to make sure that we get everybody who says yes and needs a lead service line properly serviced.
So we don't want to wait till September 18th. We want to call prior to September 18th. Because the question is, Dr. Reynolds, now, how will all this work if September 18th is the deadline? How does all this work get done if there are hundreds of us who still haven't been contacted?
Well, see, now you're talking beyond my pay grade, and that's why I say get on the schedule first. Make your request first, because if we don't have you on a list, we can't plan, and nor can we make a request for any type of extension. So that's why it is so important that you call as soon as possible and get on that list.
Thank you, Dr. Reynolds. This is very, very critical. And I think for all of our community members and those of us that are listening in today, please be as helpful as you can. Call a friend, call a neighbor, ask them if they've had this done, if they have some concerns, to make sure they get in touch with the city. And we're reiterating these numbers because it's so important. Please call the city at 810-410-1133. I mean, that's Row Engineering. But Billy Mitchell, she committed to us that we could even tell you her name and give her number out in case you absolutely need somebody that you want to talk to a voice. Sometimes we get a voicemail, but we want to talk to an actual individual. Call Billy Mitchell at the city, 810-237-2044. Thank you so much, Dr. Reynolds. That is incredibly important. Now, you mentioned the importance of our community knowing these things. There's one other issue. I talked with Tony Turner earlier this week. He's not able to be with us, but he told me to remind our community. If we go to the next slide, Tony says, for the census, we're on the countdown and everybody counts. We are now at 34 days left to September 30th for us to complete the census. You count. We always talk about your voice counts, but you count even in the census. There are now enumerators that are deployed by the Census Bureau to come to your home and knock on your door in the event that your home has not been counted. Now, Dr. Reynolds, as you're still here, we've had conversation with some of our residents, and I had a young lady call me the other day, and she said she just moved into a rental home. So that meant on April 1, no one was in that residence. Now, she filled out her census in another location, but now someone may be knocking on her door because that home has not a record of having anyone counted. And so Brother Tony gave me an answer for that. You can tell them I've already been counted at another home, because they are counting the addresses, not only the individuals. So they can check that home off if you have been counted in a previous location. Any other thing you'd like to add to that, Dr. Reynolds?
And that's wonderful information. I watched my 91-year-old mother on Ring talk to the census taker who came to her door, and you will see they have an ID badge attached to a lanyard, a blue-colored lanyard that says U.S. Census. So they are very professional. They only have those 9 questions. They don't want to get in your business, but it determines what happens to us as a community, as a state, for the next 10 years. So if you want to be counted as less than 1, if you want to go back to being 3/5 of a person, that's what you do for the next 10 years for you and your household if you do not respond to the census appropriately. So, you know, when you see that person, answer the question, and please, September 30th is the deadline.
Thank you, Dr. Reynolds. We're on a countdown. 34 days left. Please be counted. And another way that our voice is important and we matter is what has happened as a result of the community voices here in Flint. I'm so happy that Suzanne Kupel is on the call with us from the Genesee County Health Department, because as a result of the voices of the city of Flint, there are some things that you're going to hear about that are happening because those voices counted. Suzanne, give us an update from the health department, please.
So as of yesterday, we posted 3,185 positive COVID-19 test results with 278 deaths. And just a reminder, this is not reflective of all the cases of COVID-19 that have likely been in our community because we had limited testing at the beginning of the pandemic. And our positivity rate is 2.3. We are working on 3 new locations for COVID-19 testing in our community. They will be up and running soon. We know that one is Macedonia, one is Bethel, and the other is Word of Life. We look forward to sharing more information with you when those 3 faith-based partners and the HANU team that the state has hired for these community testing sites have got all their ducks in a row, and they're ready to see folks come to be tested. We still have the locations that are in our community at the Rite Aid Pharmacy in Swartz Creek and at the Rite Aid and Clio Road in Flint. We have Hamilton Community Health Network. They are providing services at the North Plain Clinic and at the fire station at the corner of Bristol and South Saginaw Street. And we also have the Walmart Supercenter location on Corona Road. Just a reminder that our partners at Genesee Health System are also doing testing at 6 locations for group homes and other settings that they actually take their services to those locations. So we thank GHS for all of their ongoing work as well. Dr. Reynolds continues to remind everyone about flu shots. Today you're going to hear from me. Today I'm reminding everyone that the pharmacies in our area are starting to get the flu vaccine in. This is an excellent time for everyone to get immunized. We encourage everyone to get the flu shot this year. We're going to have 2 respiratory illnesses at the same time, influenza and COVID-19. If we protect everyone from the flu and minimize the risk for getting the flu, will reduce the number of individuals that will need to go to the emergency room for care related to that respiratory illness. So please get your flu shot. This is also a time of year where we remind all parents to make sure that your children are up to date on all of their immunizations, so they're ready for a flu shot. Please take the time, make an appointment, call your local pharmacy or your doctor's office, and get your flu shot.
Thank you, Suzanne. I do want you to, if you could, just touch on one other thing in just a moment. But while we're at the flu shots, I want to ask Jim Melanowski from the Genesee Health Plan to talk about an event that's coming up that they're sponsoring.
Yes, we just got this scheduled. Thanks, Yvonne, for her work on that. We're doing a drive-through immunization, a flu shot clinic on Friday, September 18th. So just to hold the date on that. Yvonne, it's 3 o'clock to 6 o'clock?
Yes, 3 to 6 p.m.
And this is in partnership with Walgreens Pharmacy. They will be the pharmacist on site that will administer the flu shot. So we really want to get that going and we'll probably do more. We do a lot with the health department on flu shots as well. So, and immunizations. So more to come on that. But I wanted to get it out to this group. Friday, September 18th, 3 to 6 at the Genesee Health Plan building. We will have flu shots available, and all you have to do is drive in, roll down your window, roll down your sleeve, and get your flu shot.
Thank you, Jim. And there are a number of partners that work with us, Health Alliance Plan, along with Hurley Medical Center, and as you mentioned, the Health Department. So we appreciate our partnership and look forward to anyone. This is open to anyone in the community to come and get that flu vac. Now, Suzanne, the last thing I want to talk about for these testing is that when you mentioned the new sites that are coming in Flint, last week you emphasized that there'll be mouth swabs for the children. Can you just talk about that as we move to that?
Sure. So all of the folks who come to those 3 locations are going to get an oral swab. So they will not have the nasal pharyngeal test. And we know that a lot of people are a little frightened of that nasal pharyngeal test. This will be an oral swab. And these 3 locations will be able to accommodate adults and children. They will also be able to accommodate other individuals as well, anyone who might be deaf of hard of hearing or anyone that may not have English as their first language. So there are accommodations that are being made, and those things are in the works. So again, as soon as we have all the details about the dates and times, we'll share more information with you. I'll also let you know that we at the Health Department are working with our partners at the Genesee County Emergency Manager's Office and with others in our community, preparing what we call point of dispensing locations. So point of dispensing sites, those are the locations where when we have a COVID-19 vaccination, we will be able to provide vaccinations for everyone in the community. So we are working now in preparation for when that vaccine is available. And we'll be back with more information as things progress and we know a little bit more about the vaccine. We're hearing that it will be a 2-dose vaccine, so there will be a lot more to come.
Well, Suzanne, I just got one other quick question in the queue, and I know this may be answered by someone, but I think it's relevant even for those who are listening. Some are getting their flu shots early, and typically we talk about the flu having that 6 months protection period. So what do people need to be concerned about now, since we're encouraging them to get the flu vax earlier? And so by March or April, they may be concerned. So you have any insights on that?
I don't, but I will say, Yvonne, that we'll be back again to have more conversation about this as we see how the flu season progresses and we identify which strains of the flu are prevalent in our community. We'll keep everyone informed of that information as we learn more, but it's really important to get your flu shot now as we anticipate a second round of COVID-19. We do want to protect everyone, recognizing we're going to have 2 respiratory illnesses in the community at the same time. Do talk to your doctor or your pharmacist about which dose of flu vaccine that you should get. And we remind everyone, we strongly encourage everyone to have a medical home, a regular place, a regular source of trusted healthcare information with someone who knows about your specific health condition so that they can provide you the best guidance, not only about COVID-19 testing, about which type of flu immunization that you can get, but also making sure that you're up to date on all of your other screenings and immunizations as well. We want everyone to be safe and take good care of their health. That's also a great way to protect against COVID-19. I'll also remind everyone how important it is to wear a mask, to appropriately social distance, wash your hands, use hand sanitizers, clean, frequently touch surfaces, and take all the precautions that we keep reminding you about to protect not only yourself, but also those that you love.
Thank you, Suzanne. You have given us some great tips and a really good segue as we think about the questions that we have been receiving. I want to thank you for putting your questions into the queue. So please continue to do that. And Suzanne, you mentioned one other important thing. We are now getting a number of requests to share information. So this issue about vaccines will be a key focus of one of our future webinars. So please stay tuned. Last week, we had a presentation from Genesee Health System, and we have a number of questions that came forward. So Katie Baxter is back with us today for the Genesee Health System to talk to us and extended a little bit extension of some of those questions that were asked about the Neurodevelopment Center and family support. So Katie, please share with us.
Hello, good afternoon. I'm Katie Baxter. I'm glad to be here to talk to you a little bit about our Neurodevelopmental Center of Excellence and give you some basic information about the program. Now, the Neurodevelopmental Center of Excellence provides a variety of testing. In order to be eligible for the special neurodevelopmental testing, which is neuropsych testing, to see if your children have been impacted by lead and in what ways. That criteria does require that the child is between the ages of 3 and 26 years old, has not graduated from high school, have lived, worked, or attended daycare, school in Flint or surrounding areas supplied by the lead-contaminated Flint water anytime between April 2014 to present, and currently must reside in Genesee County. Now, it says here, to currently live in Genesee County and be exposed to the Flint water at all, we have a variety of outreach services and navigation services to help people get connected with the kinds of needs they might have, whether those are healthcare needs or testing needs, or it could just be general navigation with mental health services, food, clothing, etc. So if we're talking about getting tested and you have a child and you would like your child to be tested through NCE, this tells a little bit about the process. An appointment is made with a family navigator who will help the parent complete the screening. We have master level social workers who complete a full biopsychosocial assessment on the child, and that includes history and information about the child's development. The center will also collect other information on the assessment and testing that has been done at other offices. So if a child has had other psychological testing or medical testing, that may be pertinent information as well. The next slide. So this talks about the entitlement benefits specifically for Flint children who have been exposed to the water. We do want you to know that that COVID has had an impact on some of our processes. but we have resumed in-person testing. In the beginning, there were a lot of things that we needed to do to prepare to safely have in-person testing. And so there wasn't a time that we were getting that organized, but we did resume face-to-face testing August 17th. And we have 3 neuropsychologists on staff, and we're hoping to obtain another one, bring another one on board this fall, because there are a large number of children who could benefit from this kind of assessment. And we do encourage everyone, parents, to take advantage of this opportunity to find what both your strengths of your child are and maybe some of the challenges and ways they have been impacted by lead. There is no cost for families to receive this assessment, and the number is right there if you have questions about the services that are provided at NCE or other kinds of outreach services that you may be interested in as a result of being exposed to the Flint water. Family supports is a really important service for the community because it provides a lot of hands-on services for people in the community and finds out really what the needs of your child or your family are. We do have a master's level social worker who works with families to assess and get them connected with the services they need. Family navigators are individuals who live and work in the community and have a special investment in making sure that community members get all of the care and all of the services that they need. So the social worker is the one that after completing the assessment will make recommendations of needs for the children. And this involves what we call targeted case management services. Each child will receive at least 5 of those. And again, that looks at what are the individual unique needs of your child or children and what kinds of services do they need. Is it medical? Is it counseling services? Is it medication services? Are there other community resources that the children need help with? Is it navigation with the school? So it's a variety of different things that may be needed, and the navigator helps work through those things, and the social worker works directly with the family to ensure that those needs are met. Also, they will get you connected with any crisis services that are needed, including specialty services. The Genesee Health System is the community mental health agency for Genesee County, and we've been in the community for well over 50 years, and we provide a lot of unique and advanced specialty mental health services, including evidence-based practices to provide children necessary treatment for children who have serious emotional disturbances or developmental disabilities. So NCE and our family supports can get you connected or your child connected with those services as well. The next slide, please. Yeah, so if anybody has any questions, we're happy to answer them at any time. And I don't see any questions at this time, but I know Yvonne will make sure that my contact information is available, and our website is available, and we want to make sure those we are accessible for anyone who needs our help.
Yes, Katie, thank you so much. I appreciate you going through those details, because sometimes we talk about these things, these programs in a way that people know they're there, but not really understand those details. So we appreciate that. And again, we'll ask anyone if they have questions about the information that's been shared, please be sure to put that question in the queue, and we'll be sure to answer that for you. So thank you. And the Genesee Health System has agreed to be a continual partner with us to provide information as questions come forward. Thank you. Now today, again, we have Gary Jones with us from the state. Gary's going to give us updates from the state of Michigan, and he's always well prepared. We just have a few quick things just to remind you that Gary is always available, and we want you to know you can call him or email him. Get on his listserv. You'll get everything you need. Gary, please help us to get those key things for this week.
All right, thank you, Yvonne. Good morning, everyone, or good afternoon, actually, I should say. So just a couple updates here. Total confirmed COVID-19 cases now statewide. We are at 99,200 cases. Total COVID-19 related deaths are now at 6,424. And the total of recovered COVID-19 cases as of August 21st is 72,580. And just as a reminder to everyone that recovered is defined as the number of persons with a confirmed COVID-19 diagnosis who are alive 30 days post-onset. So recently, MDHHS announced a $25 million personal protective equipment announcement to keep frontline workers and patients safe from COVID-19. So this $25 million grant is for PPE that will allow medical facilities and other providers to keep their staff and patients safe. And like I said, it was a recent announcement, actually, I believe this morning by MDHHS. The governor also recently declared August Immunization Awareness Month and issued a proclamation declaring it so. As flu season approaches, the governor also highlighted the importance of all Michiganders getting vaccinated to protect against infectious diseases. The governor also recently maintained protections for Michigan workers during the COVID-19 pandemic by signing an executive order which prohibits employers from discharging, disciplining, or retaliating against employees who make the responsible choice to stay home when they or their close contacts are sick. The governor also recently got her flu vaccine and encouraged all Michiganders to do the same. This was at a press conference held a couple of days ago. The governor actually got her vaccine live right on stage during the press conference. And recently, the governor announced a $1.2 million IKEA donation to the COVID-19 Relief Fund. And this marks the largest donation to the fund so far to date. And lastly, for all updates, to stay updated with everything, michigan.gov/coronavirus is still the best website to do so.
Thank you, Gary. We appreciate you so much for sharing with us today. And we try to make sure that every week we bring to you those key things that the governor has done. And Gary's just been an absolutely incredible resource for us to do that. And one of the things that we know has recently happened, we talked about it last week, is the lawsuit settlement. And I wanted to remind you of what the governor's words from last week. Gary wasn't able to be on, but I tried my best, Gary, to say exactly what the governor said. So I will just reiterate for those of you that are listening that the governor acknowledges, and this is her statement. She says, "We acknowledge that this settlement may not completely provide all that Flint needs, and that many will still feel justifiable frustration with a system and structure that at times is not adequate to fully address what has happened to the people in Flint over the last 6 years. We hear and respect those voices and understand that healing Flint will take a long time, but our ongoing efforts and the settlement announced are important steps in helping all of us move forward." And you can go online and look at her particular statement, but we're appreciative today that not only has the governor made this statement, which we'll all look through and feel about it in how we feel about it in our own ways, but we're fortunate today to have a representative from the legal team to be with us. I'm going to turn this section of our webinar over to Dr. Deborah Holden, who will facilitate this conversation around the $600 million lawsuit for the city of Flint. Dr. Deborah.
Great, thanks, Yvonne. I see we do have one of the attorneys on. I want to just give a quick recap. I want to know that I'm not a part of the legal team. I've done my best to stay in the background and help with data where needed. If you go to the next slide, you'll see that, again, there was a $600 million settlement. It's considered preliminary and partial. It does adhere to the principles of equality, equity, parity, and due process as per the summary of it. If people want more information, we'll have these numbers at the end. Again, you can call 866-536-5600. 0717. You can also text the word Flint to 47177. And the legal team has given us the site of www.flintwaterjustice.com. And the city has also given a site, a recommended site, flintsettlementfacts.org. There were 7 pillars to the settlement. I'm going to quickly run through them. Broad coverage for all impacted groups. It was partial and preliminary resolution of claims. And it's partial because not all of the plaintiffs, they have not adjudicated and reached a final bottom line with all the plaintiffs. This portion of the settlement only speaks to what the state is paying. There are others who have yet to be resolved, including some of the engineering firms and some other parties. This does provide for the greatest compensation to the most vulnerable and injured group, primarily children. Approximately 80% of the settlement is earmarked for children. Awards will be made without discrimination or favoritism, and there will be an opt-out opportunity. You can say, this doesn't meet my needs, and you can then opt out and have an opportunity and an option for future individual litigation. I'll let the attorneys speak to their opinions about that. The settlement plan does require court and community approval. There will be an opportunity for community input. There's going to be a 45-day window. Community members will have an opportunity to chime in and say yay or nay and just express their general sentiments about whether or not they're in agreement with the settlement or not. And there will be some hearing opportunities to be heard in front of the judge. The 6th pillar of the settlement this was the result of 5 years of very intense litigation and 18 months of court supervised negotiation. The point being, there was a watchful eye and hand over all of it, and this was not something that just came about. There will be a set aside for schools of $12 million and for what the team has termed forgotten children. And those are children who, for whatever reason, their parents do not file a claim on their behalf during the window once this is ratified to file a claim. That child will have 1 year from the date of their 18th birthday to file a claim for themselves. So children who were impacted, but their parents or caregivers or guardians don't file on their behalf, they will be able to still have an opportunity to not be forgotten in the settlement. Remember, more information, 866-536-0717. You can also text the word Flint to 47177. You can reach the legal team at flintwaterjustice.com. And you can also go to the city site, Flint Water Settlement Facts. It's on the other side. I forgot what it was. But we'll make sure that little ticker runs across the bottom. But I did say it earlier. Okay, so we're going to go ahead real quick. I want to roll through. If you have questions, submit them using the Q&A button. We do have Trishelle Young, who is a Flint native, and our girl is on from Trishelle Young and Associates. So what I want to do just really quickly, and I trust I can't talk into the Q&A, but you guys keep an eye out for the Q&A, and then I'm going to turn it over to Trishelle if there's anything she wants to add. What happened last week is there were a few questions, and we didn't have time to get those questions answered. So I want to make sure that those questions get answered right now. So the first question is, what is the criteria and where can we find it? So the response, and this came right from the attorneys, the criteria grid is still being finalized and thus not yet public, but should be soon. The second question was, do you have a list of qualifications that will qualify a child? All children live, went to school, etc. in Flint will be eligible, but again, the criteria grid, because you can imagine a child that lived in Flint, went to after school care in Flint, and went to school in Flint, likely had a different degree of exposure than a child who only went to daycare in Flint, or a child who was only in Flint for the summer. So the actual criteria grid is forthcoming, and as soon as we have access to it, we'll make sure that we push it out to our networks, and I believe that will be publicly available for all to see and know. The next question, will special needs service be included in the settlement outside of GISD? The response here is the $12 million educational fund would help to address special needs. And then an important question that many have asked is, by taking this claim, do you give up your rights to make medical complaints in the future? And the answer to that is, if you participate in this settlement, you give up any further rights to sue for injuries in the future against those who were dismissed. So I'm going to pause there, give an opportunity for others to ask questions. Like I said, we do have Trishelle on the line. Trishelle, would you just sort of wave at the folks, say hello for a quick second?
Dr. Deborah, I wonder if Attorney Young would like to elaborate on a couple of those items that you mentioned with respect to some of those concerns that people raise.
All right, there she goes.
All right, can you hear me now?
Yes, ma'am, Attorney Young.
All right, thank you, Dr. Deborah. Which areas would you like elaboration on? She indicated, she asked if I wanted to elaborate on certain areas. Was it certain areas that she wanted me to elaborate on?
No, just if you would, or if there's anything
Okay.
you thought you could add depth, or maybe
Okay.
where my non-attorney understanding was oversimplified, just whatever's there.
Okay, thank you so much. And again, I think you really covered it very well. Those 7 pillars really kind of wrap around the entire agreement. The fact that, you know, we've been in this for 5 years and it's still ongoing. You know, we've been doing depositions, we've been hiring experts, and we've really been fighting along this path. And so to get to a point where both sides feel like this is a fair and reasonable settlement amount was a tremendous amount of work under the auspices of the court supervision. So you already covered the categories, and as indicated, of the $600 million, 80% is set aside for minor children. And so 65% of that 80% is for ages 6 and below. And then 10% is for ages 7 to 11, and 5% is for ages 12 to 17. So that's basically how that 80% set aside is broken down for the minors. 18% of the settlement is for adults and property damage. So 15% out of that 18% is for adult personal injury. So, you know, we've all heard the stories of how people had stomach problems, loss of hair, just all type of rashes and conditions. So those are those issues, from hospitalization to Legionnaires. You know, they really range from very mild symptoms to the most extreme, which is, you know, from the Legionnaires resulting in death. And so that set aside is for 15% for adults with the personal injury. 3% is for property owners. So I myself am a resident of Flint, and I had to replace my hot water tank. I had to replace some pipes throughout my house. So, you know, people had to replace faucets, they had to replace drains, whatever injuries or damages they sustained to their property, there is a set aside for a claim for property damage. So 0.5% is set aside for businesses that lost money, that lost their customer base, that lost their income. And so they will be able to make a claim based on the loss of business. And then, as you indicated, you know, 12 million is going to GISD. And then there's a 35 million that's set aside for, as you indicated also, kids whose parents or guardians just don't partake in this process. And so they will be able, when they turn of age, to file a claim on their own behalf. So we made sure that there'll be something left in the pot for them. So, you know, this was a long 18-month process, intense negotiation back and forth, but we believe it resulted in a fair settlement. And we're making sure that even the people who did not take their kids to the doctor, who don't have that blood lead level results, they still can file a claim and make their case in front of the court-appointed mediator. And so we really wanted to make sure that the entire community is not left out. No part of the community is left out, and everybody has an opportunity to pursue it. But also, Dr. Deborah, as you mentioned, they can opt out. We understand that for some, it's not a one size fits all, but we also want to make sure people understand that there are consequences to opting out of a potential settlement of this nature. And, you know, if people were concerned about how long it took us, the 5 years to get to this point, by opting out, they could be looking at another 2 to 5 years before they see a resolution in this matter. So, you know, we just want to encourage people to educate themselves, make sure they reach out. You've given all of our contact information. You know, we are trying to push it on the radio. We're taking ads. We're present in any community functions so that we can actually address the concerns of the people. We know it's not the perfect fit, but it's a great start. And, you know, I personally support it and recommend it. And I'm here if anybody has questions or concerns, and we'll try to get them addressed to the best of our ability. So thank you for this time.
Great. Attorney Young, somebody did not put it in the Q&A, and I don't know why, but they text me a question.
Okay.
And the question is, does the $600 million settlement include the attorney's fees?
Yes, it does. There will be a set aside from that pot that will cover the attorney fees as well as the expenses that have already been put into pursuing this case. But there is no specific dollar amount. That will be determined at a later date by Judge Levy once the attorneys submit documentation that verifies, you know, the costs and the expenses that have been put into pursuing the case.
Gotcha. And so then the percentages that are being paid out will be the percentages once that fee has been determined.
Yes, ma'am, that is correct.
But the fixed amounts of $12 million for schools and $35 million for delayed claims or deferred claims for forgotten children is a fixed amount.
That is a fixed amount that will not change.
Great, gotcha. Okay,
Deborah,
I'm surprised.
I'm in the same.
Yeah.
Yeah, well, I think Dr. Deborah, because they may have asked the question. I got a couple questions here too. And one of those is, it's, you know, people sometimes like to be able to know they can connect with somebody in the community. Where can people go? Do you have an office here in Flint that people can actually go to or call?
Absolutely. The office is located at 1188 Robert T. Longway. And that's right behind the Holiday Inn Express, right off of I-475. So it's very conveniently located, just short of downtown area. But we've been there for several years. Right now, the office is not open to the public to do walk-ins because we are very COVID conscious. And so we are equipping the office with the partitions to make sure once we start allowing clients to come in and process their paperwork or just to get information, that they can do so in a safe and COVID compliant location. So I'm there daily from 10 to 2 normally, from Monday through Friday, but I'm the only one there with my assistant. And so we don't take walk-ins until, like I said, we get done adapting the office to make sure it's COVID compliant. But 1188 Robert T. Longway, that is our office.
Okay. I had one more question that was brought forward. And one is,
okay,
some of the residents are concerned that the settlement does not or will not address the long-term issues that community members will face. And we know you've said that this is preliminary and there are other organizations or groups that are in the process of being addressed, but how do you explain this to the residents that, you know, this isn't all and there are some things that still need to be considered?
Well, that's a great question. And we explain it by really trying to emphasize and stress the fact that it is a partial settlement. It is the first contribution to the pot that will be available for this community. So as we indicated, I think Dr. Deborah mentioned, the city of Flint has yet to put up anything in this pot. The engineering firms, Veolia, as well as Land, both of them have yet to put up in the pot. And we have a very strong case against the EPA, which is the federal pocket, and they have yet to put into this pot. So this is one of the main reasons that we need to stay and hear what the community concerns are. We understand that the portion that is set aside for the adult personal injuries, is not sufficient. And that's why that is still on the table. Whatever we negotiate going forward, we will make sure that those areas are fully compensated to the extent that we can have it done. So that's why we're listening to the concerns of the community, so we can make sure as we move forward, we cover those areas that this initial partial settlement does not cover.
Thank you, Dr. Young, because I think it's critical to understand who those other, and am I saying it right, litigants? Is that the right way to say it? Defendants? Okay.
Yes.
The defendants are, and you're saying City of Flint, Land, and Viola, which are engineering firms, and the EPA.
That is correct.
Okay. Dr. Deborah, I don't know if you had some more questions come your way.
I have one more quick question, and then we do have a couple other things we want to cover. And I just want to really acknowledge and appreciate Attorney Young, because I know that it's been a long road and it's been very busy. And I also know that the work is not done. We still have these other claimants, defendants to try to reach resolution with. The question that you raised, and it's not my question, but I imagine others may have it, is you said, this is the state of Michigan who's contributed to the pot, but they are not the only ones. So if, as other settlements are reached, people are also eligible for compensation as the other parties then contribute to the pot, correct?
That's an excellent point. That is correct. By people partaking in this settlement, it does not in any way preclude them, or I guess a better term would be exclude them from additional monies that will be coming. And the way that this pot is designed is actually so these other defendants can add to it. And so that's why, it's important that people educate themselves, because there is going to be a finite window where people have an opportunity to take part into this settlement and to submit a claim. It's not going to be open forever. And so I don't want people to miss the window of opportunity, thinking that they're going to wait for something bigger. When that bigger comes along, they will be able to take part in that as well.
This is an important point you're making. So if somebody does not sign up now, let's say it takes 2 years to reach resolution with one of the other parties, are they eligible to opt in at that point?
They may be eligible to opt in at that point, but certain portions of the pot will have already been distributed. We are anticipating that as early as next year, the claims adjudicator will start authorizing payments from a specific pot. So what I'm saying is, once the attorney fees are determined, once the expenses are determined, and the categories are solidified for how many litigants are eligible for the particular categories, monies are going to start getting distributed, because one of our primary concerns is that the residents of the city of Flint have already waited long enough. So we don't want this thing to continue to drag on and on and on, which is one of the primary reasons we're doing such a tremendous push to let people know, listen, here's a window of opportunity. At least call us and find out what's going on, what you need. We can give people a checklist. A lot of people are discouraged because they're like, well, I didn't keep my pipes, and I didn't keep this, and I didn't take my child to the doctor, but they still need to check in with us because they're still eligible to submit a claim. We know a lot of people don't have certain evidence because the state was telling people there was nothing wrong with the water. So, they can't discourage you from actually getting your child checked out and then say, well, you're not eligible because you didn't get your child checked out. So because we understand that 360 circular argument, we are encouraging everyone, and we are ensuring in this process. And that's why we say it's a fair, and there's going to be parity and equity, and it's non-discriminatory, because we know all kids were exposed in some shape, form, or fashion. We just need to determine the degree and the extent so that we can ensure they fit into the right category.
Okay, one last quick question.
Okay.
The compensation structure, as it's laid out right now, will that hold true for future pots, monies that get added to the settlement pot?
That I can't actually speak to that. I don't know, you know, we're negotiating with different parties. So all of that would be part of that negotiation and part of what still has to be approved through the court process. So that we kind of have to wait and see.
Okay, great. All right, I got it. That was great, Attorney Young. Thank you so much for taking time out to be with us and help bring some depth of understanding to some of these important questions. And thank you for all your great work on it too.
You're welcome. Thank you.
Well, Dr. Deborah, I just, before Attorney Turtle leaves us, I want to put this on for our thinking, because obviously we're going to invite them to come back. But there is more than one legal firm out soliciting residents to connect with them. So I think just to put this out for us to think about in a future webinar, hopefully next week, we can talk a little bit more about how residents will make a decision about how to select their legal representation for this lawsuit.
Absolutely.
So Dr.
Please have
Deborah,
us back. We would love to discuss that.
okay. So I'm tossing it back to you, Dr. Deborah.
Okay, great. I'm gonna give it, ask our wonderful slide person to go forward 4 slides, because what we don't do is not end on time. So I wanna recap a couple of other recommendations for folks. We always say, stay safe, honor the protocols. Right before this webinar, myself and many others, I was trying to get, Yvonne, we got your question in. Tanya French Turner, I know she's on our HFRCC Community Court Co-Director. We were able to get Yvonne's question answered, not Tanya's. The director of the CDC, Dr. Robert Redfield, was on. He basically said, oh, there was some context missing to our recommendations. He said a few things. The CDC, and we asked him directly, are you all going to revise that statement? Because the statement that was made and the way it was made was very confusing in a time where misinformation is inundating our communities. They are, he said he has 2 different versions of it right now that are being vetted, and a revised statement will likely be out from the CDC, if not today, predictably within the next 24 hours. So it's an interesting thing, because I always tell people, your trusted, credible sources of information are mostly your local sources. The CDC remains a resource for us, but if something is said or done that doesn't make sense to you, ask your primary care physician, ask your medical provider. If you don't have one and you're on this webinar, we have physicians on this webinar who can advise you. We have the director, Clarence Pierce, for our federally qualified health center. We are all here because we want to make sure that this community has what it needs and has credible information to navigate. Okay, so that's the first thing. Stay safe, honor the protocols. If unclear about the protocols, we're here to bring clarity. Complete your 2020 census. The website is my2020census.gov. 10 minutes, 10 years of funding, more than $1 trillion at stake for Flint. And this is something else I've been really pushing for folks, to plan your vote and then vote your plan. We've seen all of the activities and the attempts at voter suppression. The best thing you can do is come up with what is your voting plan, and then you work that plan. If it's absentee ballot, you know the mail has been delayed, etc. Get that in place right now. You can also go to vote.org. That site has been vetted. I forget the name of the group, but it's a primarily African-American driven group that founded this. And the status of those that you know and care about. If you're registered, make sure that they're registered and everybody get a plan in place. Our vote matters and we need to be heard in this election. That's it for me. You're on mute, being brilliant.
I'm so sorry. We are right on track now. This is great. As we close the webinar today, we want to invite you to join us on Facebook. Just like us on Facebook, Healthy Flint Research Coordinating Center.com. Please subscribe to our YouTube channel and include any questions on our email at info@healthyflint.org that you might have. It helps us to build future sessions. We also want to remind you that at the end of this session, you should receive a pop-up survey. As you complete those surveys, a young lady is so diligent. Every week, she lets us know what your questions are. and we're doing our best to ensure that we answer those for you. So please respond to that email link. You should get it within the next few moments, or at least within the hour, and give us that update. We will be back next week, September 4th. So please join us. We encourage you. We look forward to having a wonderful Labor Day weekend. And thank you for joining us today. Healthy Flint Research Coordinator Center community webinar on coronavirus. We thank you and look forward to seeing you again next week.